Hello, my name is Maggie Shear, and in this presentation, I'm going to be talking about asthma education. All right, so I understand you've just been diagnosed with asthma, so I'm here just to explain the disease a little bit so you have a better understanding of what's going on. So, asthma is a chronic condition affecting the airways. In people with asthma, these airways are more sensitive and prone to inflammation. So, think of your airways like flexible breathing tubes. With asthma, three things can happen. The first would be inflammation, where the lining of the airways becomes swollen. Next is bronchoconstriction, where the muscles around the airways tighten. And finally, mucus production, which causes extra mucus to clog the airways. And when this happens, it becomes harder to move air in and out of the airways, which causes symptoms like shortness of breath, wheezing, chest tightness, and coughing. Symptoms can come and go, so some days you may feel worse than others, and some days may feel completely normal. You may be asking yourself what triggers asthma, and this is really dependent on the person. Different people have different triggers, but some of them include allergies like pollen, dust, even pets can cause allergies, and mold can also cause allergies to act up. Cold air can trigger asthma. Some people have exercise induced asthma, respiratory infections, smoke or strong odors, and even stress. These potential triggers could cause an asthma attack, otherwise known as an exacerbation. And an exacerbation, in simple terms, is what happens when your asthma symptoms suddenly get worse. So, what exactly happens during an exacerbation? So, first, airway inflammation increases, and the lining of the airways becomes swollen, red, inflamed, and more sensitive. Next, airway muscles tighten, which is also known as a bronchospasm. When this happens, the smooth muscles surrounding the airways suddenly contract, squeezing the tubes, which are already inflamed, and that's called bronchoconstriction. Think of this like tightening a piece of string around a plastic straw. Next, mucus production will increase, which further blocks airflow and makes breathing even harder and can cause you to cough. And next, air gets trapped. Since it's so hard to breathe, air becomes trapped in the lungs and they become overinflated. This leads to wheezing, chest tightness, shortness of breath, and coughing. And finally, in more serious exacerbations, oxygen levels may decrease, carbon dioxide may build up, and breathing can become labored and tiring. And this is when emergency care will be necessary. So, here I've created for you an asthma action plan. And this asthma action plan is basically just a personalized plan for you that helps you know how to manage your symptoms and what to do in the event of an exacerbation when your symptoms get worse. Your plan is broken down into three zones based on how you're doing with your symptoms. In the green zone, you're doing well. You're breathing normally. There's no coughing, no wheezing. You're able to work and exercise without difficulty and sleeping well throughout the night without any complications. So, in the green zone, you'll just need to take your daily controller medication, which is your corticosteroid. For you, it's fluticasone, 2 puffs daily. That's just going to help prevent symptoms before they start. So, about 10 to 15 minutes before any exercise or physical activity, be sure to do 2 puffs of albuterol to prevent any bronchospasm that may occur during your exercise. Our goal in the green zone is just prevention and keeping inflammation controlled and preventing flare ups before they start. Moving down into the yellow zone, this is going to be our cautionary zone. In this yellow zone, you may be experiencing some breathing problems, maybe coughing or wheezing, chest tightness, maybe difficulty performing activities or exercise, and you may even experience some difficulty sleeping through the night. If this occurs, you should take 2 to 4 puffs of albuterol every 4 hours or as needed. For more acute symptoms, you may repeat doses every 20 minutes for up to an hour and continue taking your controller medications as prescribed. If your symptoms don't improve in the next 20 minutes to an hour or so, or if they worsen, you'll move into the red zone. And this zone refers to the onset of severe symptoms like significant shortness of breath, difficulty speaking, worsening of symptoms despite your controller medication and your albuterol. In this zone, if this happens, quick relief medication should be taken immediately. And if there's no improvement after using your rescue inhaler, you should seek emergency care by calling 911 because this will now have become a medical emergency. This action plan overall will help to provide some guidance for you on daily management and prevention, how to recognize your symptoms, and what to do in case of an emergency. Now let's talk about how to use your inhaler. So first, your MDI with a spacer. I'm going to explain how you're going to use your meter dose inhaler with a spacer. Using a spacer is beneficial here because it helps more of the medication reach your lungs and it makes the inhaler easier to use. So first, you're going to remove the cap and check the mouthpieces on this, both the spacer and the inhaler itself, to just make sure that they're clean. Next, you're going to shake the inhaler for about 5 seconds so the medication has a chance to mix. Then you're going to place your inhaler into the back of the spacer. Take a full, complete breath out just before taking the medication. You're going to place the mouthpiece in your mouth with a tight lip seal around that mouthpiece. And when you're ready, take a big, deep breath in while simultaneously pressing down the inhaler to release the medication. After you take your big, deep breath in, you're going to hold your breath for about 10 seconds or as long as you can. That's going to really allow the medication, the particles in it, to settle into the airways and into the lungs. And then you just take a nice deep breath out slowly. And if you are prescribed to take more than one puff, you want to wait at least 60 seconds and then repeat that cycle. Next is your dry powder inhaler. This we will not be using a spacer for. So your DPI will be a little bit different. First, you're going to prepare your inhaler by inserting the capsule or sliding the lever over, depending on the instructions for your specific device. And you want to make sure to hold the inhaler level so that the medicine stays in place. Next, you'll want to breathe out fully to empty your lungs of any air. Then you're going to place the mouthpiece between your lips and seal your lips tightly around it. Take a quick, deep breath in through your mouth. Dry powder inhalers require strong inspiratory force in order to pull the medication into your lungs. So you want to make sure that that quick, deep breath is very quick and the strongest deep breath that you can take in. Then you can just remove the inhaler and hold your breath for about 10 seconds, just like with an MDI, or as long as you can comfortably. And this will allow, again, the medication to settle into your airways and into your lungs. Then you're just going to breathe out slowly and repeat as prescribed. And if you're using a steroid in your DPI, be sure to rinse your mouth after to avoid thrush.